My name is Dr. Akil Taher. I am a vegan and I have transitioned being a vegan in 2009, but I became fully vegan in 2011. I am a practicing physician doing telemedicine, living in Atlanta, Georgia. A lot of people become vegans for different reasons. Some for health, some because of cruelty to animals, and some for climatic reasons. Well, in my case, it was due to health. That was the reason why I became. My wife and my daughter, they also turned vegan 25 years back, but their reason was cruelty to animals. I was a lover of unhealthy, processed, refined foods, the standard American diet of meat, eggs, and dairy, or the standard Indian diet, which is equally bad with saturated fats and ghee and oil. So to me, I was a seafood eater. S-E-E. I ate everything at sight, be it Italian food or Mexican food, sushi. I just ate everything at sight. Plus, I was a couch potato. I did no exercise. The only exercise I got was to my eye muscles looking at joggers run in the park. And on top of it, I had a type A personality. So I had a lot of stress. Everybody has stress, but I could not handle stress. It was no surprise that I got heart disease, came knocking at my door at the age of 56. Now you would have believed that by this time I would have changed. They opted that I should either have stents put in or to have open heart surgery. I chose stents, and during the procedure, my plaques were so thick that they had to use a diamond head to shave off the plaques. And in the process, I got a cardiac arrest. My heart stopped. They had to shock me to revive me, and I can still see those pedal burns on my chest. And they had to stop the procedure, and then again next day, they had to redo the procedure of cath. 3 days after my stent procedure, I went back to work. Now, people, you would think that I would change my life after this, but I did not. I got severely depressed. I used to sit on chairs looking up at the ceiling, having crying bouts, keeping my face in my hands for a long time. Also, my nights were terrible. I used to sweat a lot. My mornings were no better, no energy. There were tormenting thoughts running riots in my mind. So at one time, I even contemplated suicide. Now, all these negative feelings also manifested in physical problems. So I had sinuses and bronchitis visit me every year. I had the infamous diverticulitis twice, both times perforated, and I was admitted for 15 to 20 days each time in a hospital with IV antibiotics going on, which led to severe mouth ulcers that lasted for long periods of time. Enlarged prostate, acute retention of urine, again I was put into the hospital. This time they put large catheters to remove those clots. It was like somebody taking a steel rod and putting it in your genitals. It was not a surprise that my stents and my angioplasty failed, and I had to have open heart surgery. Now starts my life. This is a time when I started eating better, exercising, meditation, yoga, and pranayama. I first became a flexitarian. I just cut back on meat, eggs, and dairy.
So how did you know that you had heart problems when you were 56?
Well, I was in London meeting a friend of mine, and we were walking in London, and suddenly I felt a discomfort in my chest. Now, being a physician, I knew there was something going on. But at that point in time, I was thinking of every reason in the medical books to think that it was not my heart. So I sat down on a bench, I remember, and then I told my friend, just let's relax and rest. I didn't really tell him why. And then we started walking again. This time I timed myself, and I distinctly remember 4 minutes, and I got the chest pain again. I sat down and rested again, and I knew it. So I decided to cut short my trip, come back to the US, and had to get a stress test done, which was positive, and then an angiogram was done, which suggested blockages.
So then you get the stents, some time passes, and you really didn't change your diet or lifestyle after that at all. You started having all these other problems, enlarged prostate, having diverticulitis, and maybe some other issues, depression, suicidal thoughts. What exactly prompted, oh my God, now I gotta get a bypass?
The point was that when my stents failed, I had to have surgery. There was no other recourse. Now, when I was told I was going to have surgery, this is the time there was an inflection point in my life. You call it reflection point. I was now tired of leading a life I was. So I had two options. One was to carry on this mediocre sedentary life like my heart patients and live vicariously through my children, my grandchild, and be on a rocking chair and wait for the inevitable death. Or I could turn this setback into an opportunity. And that's what I did. I decided to turn this into an opportunity with the help mainly of a whole food plant-based diet, but also exercise, meditation, yoga, and breathing.
Now, how old were you when you had the bypass exactly again?
61.
61. And at first you were flexitarian, so it took some time before you actually got to the whole food plant-based. So you started exercising first and eating a little more consciously toward healthy things, but still the flexitarian thing, not vegan. What happened to make you go vegan after getting your bypass and exercising for a while and doing the flexitarian thing? What made you suddenly realize you better go vegan or whole food plant-based?
The thing that I would promise the nurses at the hospital, that I would do a half marathon if all goes well in a year's time. So in 8 months, I did my half marathon. Then I started doing marathons or long distance running, 10Ks, 15Ks. But I still had problems. My diverticulitis would flare up at times, not as bad, but at times. Or I would have a kind of feeling of lethargy after the run. I was also not having enough energy. And so I was wondering that I'm doing everything right. I'm exercising, I'm meditating, all those things, and I'm eating better. What could it be that is still causing my problems with my diet? Then it occurred to me. I don't think at that time it was science or anything in my mind, but I said, wait a minute, could it be the diet? Because I'm doing everything else that I'm supposed to do. My stress levels had gone down, my type A personality had mellowed. So what could it be? That's the time when I transitioned into complete whole food, plant-based, vegan. And that is the time, let me explain to you, each time I would do a long run, long distance prior to my turning vegan, I would always have a large carb meal before the run, and even protein, and then a lot of animal protein after the runs. That kept me at home in bed for 4 or 5 days. And so I started wondering that maybe it's my diet. I don't know. So I started now going on a vegan diet. So when I had my 100-mile bike race, that was the time, it was in Mobile, the temperature was something like 30 degrees. It was very cold, there were crosswinds, there were gale force winds. We literally had taken 9.5 hours to do this bike ride. And after we did the bike ride, we came back, my trainer and I, and we were feeling so good that we went on to a vegan meal, and we decided to go back to my hometown in Gadsden, Alabama. As we were going, I got a call from my clinic saying that they don't have a doctor the next day, and would I be able to come in? And I said, okay. So here I am, 9.5 hours of biking, 6 hours to go there, next morning working for 10 hours, and I was absolutely great, like nothing had happened. I didn't have to rest for 5-6 days. I was working the next day after that, and I was okay.
How did you know eliminating animal foods was an option? How did you know that? Like, what made you think I better try this? Was there something you read? Was it something you saw?
See, when I had to have an open heart surgery, when I decided to change my lifestyle, I did read a lot. I read the gurus in medicine and the research, like Dr. Neil Barnard and Dr. Dean Ornish. All these people had one thing in common. They all said that the standard American diet of meat, eggs, and dairy was harmful to the body, while a whole food plant-based diet was the way to go. In fact, what I read was, which really caught my eye, was the whole food plant-based no oil diet is the only diet that can not only prevent and treat, but reverse heart disease. And that is where I said, wow, there's something that can reverse what I've got. So I make a very bold statement in my book, which I've written, that had I known then what I know now, I would not have gone for stents or surgery. I would have looked for other options of the whole food plant-based diet, which have been proven to reverse heart disease. Now, having said that, let me be very clear. People should understand this, whether you have had no surgery, stents, or surgery. The important thing is that this is band-aid treatment, because you have to change your lifestyle so that your inner lining of your coronary artery or any artery in your body, whether it is your brain artery, your kidney artery, your leg artery, your penile artery, all these arteries have the inner lining endothelium, which keeps the artery dilated, blood flowing smooth, and protects the arterial wall. The moment you eat a standard American diet or a standard Indian diet or what have you, you are disturbing that endothelium. So now you get all this cholesterol and fibrin and calcium depositing. And sometimes it takes decades to form a plaque, a big plaque. And when this plaque starts narrowing your coronary artery and you start getting chest pains, that is the time we doctors call it angina. And for angina, you don't necessarily have to do stents or surgery. It can be reversed by whole food plant-based diet without damaging the endothelium, because what the surgery does and what stents do, they destroy the endothelium. Now, having said that, if you are getting a heart attack, please, you have to go immediately to the emergency, and they will take you to the cath lab, and boom, 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 they will take the clots off and they will do a stent and surgery. this is a must. But in my case, no. 50% of stents and bypass surgeries done in the US are not necessary.
You went flexitarian after your bypass, and you had already read these things. Why didn't you do it right away?
I will not make any excuses. I loved my bad habits of food and all that. Remember, I was brought up in a family that we used to have breakfast, lunch, and dinner meat. So to me, it was difficult to think of giving it up. What I thought was with my exercise and with my meditation, maybe I could overcome. I was not ready to change at that time. I was ready to make other lifestyle changes, but not diet.
Okay, so you have your open bypass surgery, right? And you're 61 and you think, I'm going to change some things, but diet was the last thing to go. To change, right? And
you're right.
Yeah. I feel like I have a lot of friends who they never want to try diet. Like you would think diet would be easier to change than trying to exercise, because exercise is a lot of work, right? To me, just stop eating animals and eat beans and greens and grains and fruits and veggies and mushrooms and nuts and stuff instead. That's kind of easy. That's easier than going to the gym every day and jogging, But for some reason, they always want to go to the gym and not change their diet. And in my mind, I think that's got to be really dangerous, because if the food is the core cause of these problems, couldn't exercise exacerbate those problems and become like a deadly thing that makes things worse?
That is so right. To give you an example, the older first generation South Asians like me, like I am, we did not know the meaning of exercise, so we did no exercise. We did not know how to spell exercise. Now, the second generation of South Asians, like my son, these are very, very in tune with exercising. But trust me, if they come home and eat their mama's cooking or eat the bad diet, then they are still prone to diabetes and metabolic syndromes. So diet is more important than exercise. See, you cannot outrun your diet. So the whole idea is that we keep blaming it on genes. I had genes which were good on my father's side, but terrible on my mother's side. But genes play a very little role, 5 to 10% in somebody's health outcome. And that too can be mitigated or negated by lifestyle changes. You also have epigenes now, which do not actually change the genes, but make the genes act in a better way so that you do not have to have all these problems.
You were saying, had you known what you know now, you would have opted for making lifestyle changes over an invasive procedure. This makes me think about people like that I know who did statins for a while, that didn't work. Then they ended up getting open heart surgery like you did. And I'm afraid that's not going to work, but they're not making these changes like you are. Is it more often the case that these things just don't work? And why aren't hospitals advocating whole plant foods if that can ultimately be the core resolve?
You know what Maimonides said? No disease that can be treated by diet should be treated by any other means. Okay, so we are talking about nutrition. We are talking about food. If that is so important, why is it not being taught in medical schools? And I became a doctor, 0 hours of nutrition. When my son became a doctor, 4 to 5 hours a year. That means 20 to 25 hours in 4 years of nutrition. Now I believe that what Dr. Neil Bernard and all are doing, that there are residencies that are teaching nutrition, but not again to the level. Another thing is that our pay system for doctors is based on procedures. That is going in along with the insurance companies. So the whole idea is that if I am going to spend 15 minutes and talk to you about nutrition, I am not getting paid as much, or doctors are not getting paid as much as if they are dishing out high blood pressure medicines, cholesterol. It is shorter for them. It's a 5-minute this thing, and they can get much more out of it than when they are really doing a nutrition exercise with their patients.
So essentially, statins more than likely are not going to be effective. Stents, bypass, unless the person changes their lifestyle behaviors, is what you're saying.
Absolutely.
That's sad. I had a relative get bypass surgery, and I looked at the menu that they were serving at the hospital and to the patients. And I mean, it's mind-blowing, the disconnect there. It almost should be illegal, like what they're doing. Any initiatives that you're aware of that are working to change this?
I think we are getting better at it, but it'll take a long time. A good medical diet, as opposed to a whole food plant-based diet, does say that you eat more vegetables, you eat more fruits, you eat more legumes, more beans, more grains, nuts. But at the same time, they also say that you need animal protein, like a piece of chicken, not fried but broiled. Or you need a dairy, a cup of milk, which can be not 2%, but low fat or no fat. So, and also eggs is there as a healthy item in the medical diet, which is now talking about healthy eating. So my point is that meat, eggs and dairy and sugar are the biggest adversaries of men. There is nothing two ways about it. These are things that can cause you harm in the long run. When I came to this country, I rarely saw a person at that time who got diabetes at the age before 50 years. Now I'm seeing 20 years and 30-year-olds getting diabetes, type 2 diabetes. And all these chronic diseases, whether it be diabetes, blood pressure, high cholesterol, obesity, all these have a few things in common. One is inflammation, number one. Number two is oxidative process. Number three is disturbance in your gut bacteria. Number four, shortening of your telomeres. And number five, overstimulation of your sympathetic nervous system. So all these are man-made. Why do we always, as doctors, we are great at it, the consequence of the disease. So we can make a person live longer. Why are we not just treating the cause of prevention? It is like a sink which is overflowing, and all you are doing is mopping the floor. All you have to do is turn the faucet off. If we can do this, and if we can be active in this, we can save billions of dollars on healthcare in this country.
Why do they still include animals as a protein source? Why?
Because that's where the big industries and money is. The thing is, let me explain this. Animal protein and plant protein have amino acids. All the amino acids in both are the same. But the amino acids in animal protein is far greater. This excess of amino acids in a small quantity without any fiber is the root cause of all problems with animal protein. Americans only eat 15 grams of fiber when we should be eating about 45-50 grams of fiber a day. So most of my patients have chronic constipation, diverticulitis, irritable bowel syndrome, dyspepsia. So this is what animal protein is doing. Then the nitrogen waste that they cannot take off. So you start getting your renal problems. When you think about it, there are other issues like osteoporosis, or when you think about renal stones, all these are basically the animal protein. Now, take for example, if you take a 10-ounce steak, you have 70 grams of protein in that. Now, you need only 56 to 46 grams of protein. I have yet to see in my 45 years of practice Anybody being protein deficient, you do not need that extra protein, whether it is in the powder form or whatever. The whole food plant-based does give you the protein that you require.
Okay, so there's a channel on YouTube that recently did a video on protein, and consistent with what you're saying, you know, talking about amino acids specifically, they say that while you can get just as much protein from plants that you can animals, the amino acid profile or distribution in plants is significantly lower in certain amino acids, like lysine, for example. And I think they say, you know, as a result, you can't synthesize or metabolize other proteins or whatever because you're not getting enough of this one amino acid, for example. Now, I've noticed when I track the amino acids that I eat, you know, it could be harder to get your RDA of all those amino acids. But when I compare it to if you put animal in there, you do get a lot more amino acids, but you also get a lot more of these like sulfur-containing amino acids that are culprits to like cancer, for example, potentially. Because if you restrict those amino acids, you can potentially reverse that or prevent like metastases or tumor growth or whatever. So, it's kind of a weird dilemma there. Like, you're damned if you do, damned if you don't. You know, they're saying if you don't get enough certain amino acids, it can cause problems. And we're saying if you get too many amino acids, it could cause problems. What do you know about like maybe not getting enough of certain amino acids from plants?
Show me one person who is whole food plant-based diet, who is protein deficient and is suffering from that amino acid. You will not find any. My prime example is me, because I turned over to plant-based protein from a very heavy animal protein diet. All my diverticulosis, diverticulitis, all this is gone. Gut bacteria that acts on a choline, and that becomes the TAMO oxidase in your body, which is a single factor of causing inflammation in your arteries and is the cause of atherosclerosis according to some cardiologists.
You talk about trimethylamine oxide.
Trimethylamine oxidase. And bacteria acts on choline and converts it. So
Carnitine, I think also, there's two maybe.
Correct. And then you have, look at our barbecues. We, at our high heat, and these proteins, when they're high heat, they form heterocyclic amines, which are also cancer causing. There is no benefit from animal-based protein.
Now, some people might argue, well, these people probably are eating a lot of processed foods, and when you remove those, they get better. But in your case, were you eating processed foods a lot when you were flexitarian, or I don't know?
No.
So the only thing you really changed was your source of protein, for lack of better words. You changed by not eating animals and just eating more beans.
But also, I gave up dairy. Dairy to me is liquid meat. I tell my patients the first thing that to give up, and they find tremendous immediate effects, is to give up dairy. All their allergies, the sinuses, the mucus formation is all decreased. I don't think that in the animal kingdom we have any species that keeps drinking milk after they're weaned, with the exception of humans. And we are smarter. We are not only drinking our own, we are drinking a cow's milk. Now, cow's milk has a lot of lactose, and people say that I'm not lactose intolerant. They don't know. They think that getting distended and flatulent and burping is all the normal things that happen when you have a good quote, unquote, a good diet.
What did you notice different after really becoming vegan?
The thing was, first was physical. My energy levels shot up. So, being septuagenarian athlete myself, endurance athlete, I started finding that my preparation time for any sports decreased. My performance time, say I used to do 5K in 12 minutes, now I can do it in 9.5 minutes. So that, and then my recovery time. Sometimes you get an ankle sprain or shin splints or whatever when you are an athlete. What I found was that my recovery time after a sports activity or injury was far less than before. So these were all the physical. Mentally, I was also much more calm, much more compassionate. I started listening to my patients more. I started sleeping better. I started getting clarity of thoughts. And that made me go where my wife and daughter were. They'd become vegan 25 years back because of cruelty to animals. Now I started feeling that this was not right. We should have empathy towards animals that live with us. Then I went to Mount Kilimanjaro and I saw the dwindling caps over there, snow caps. And I said, it's destroying our earth. All these things made me overall a better person. The best of me that I can think of.
Yeah. I say living with complete integrity. And some say without cognitive dissonance. Now you have continuity and more peace. Your wife and daughter went vegan before you. And maybe that was a little bit of an influence, right? Maybe? No?
No. I'm sorry. 25 years back or 30 years back, if there was an influence, I could have done it at that time. But I did not.
Wow.
I did not. I did it purely for health reasons, but now I'm more compassionate and wondering that what we are doing to the creatures on earth.
You're talking about dairy. It's cool that you say that should be the first thing to go for a good progression toward this. Get rid of dairy first. That's great. Because people have the hardest time with dairy too, so maybe that helps tackle that, and the rest might be easy, right? But it's also the most cruel. It's also the most cruel industry.
To let the cow give you milk, you have to impregnate the cow constantly with estrogens. So all you are getting is estrogen in your this thing, which is proven now for prostate cancer in men. We get this calf that is born and we steal this calf and put it into crates and then sell it as veal in restaurants. If this is not cruelty, what is? We are not thinking about somewhere in a village where somebody is milking a cow. We are talking about these huge cups that extract milk so you get lacerations on the udders. And that causes tremendous amount of pus. That's why we use a lot of antibiotics. Now these antibiotics are going to come to you. Now what do antibiotics do? Kill bacteria. What does it do in our bodies? The gut bacteria, the microbiome, it destroys its gut bacteria. We are using more antibiotics on animals right now than human beings. And that indirectly comes to human beings. Other issues about my patients coming with acne and sinus congestion, stones, kidney stones, all these things can be handled if you are going to give up. The first thing, in my opinion again, is to give up dairy.
In your native country, aren't they predominantly vegetarian?
80% of Indians in my country, India, are vegetarians.
Wow.
And I have heard a lot of my friends over here tell me, you people must be great healthy because you're all vegetarians. But this is my opinion, that to be a junk food vegetarian or vegan is as bad as putting the flesh of an animal in your mouth. 80% of Indians are vegetarians, but they're junk food vegetarians. They love their processed, refined foods, saturated fats, and oil and ghee. Do you know that we have a cultural connection to oil? We feel that it is a sign of warmth if we use more oil, generosity if we use more oil. So if you go to some Indian house and they've invited you, if you see a pot of curry, and if it does not have a big layer of oil, like the Valdez slick, you feel that you are not doing justice to your guest. Ghee, oil, processed foods, sugary snacks. That is why we Indians, even though we are 25% South Asians, when I say South Asians, I mean India, Pakistan, Sri Lanka, Bangladesh, as far as Maldives and Bhutan. We are South Asians. We are about 25% of the world's population, but we carry 60% of the world's heart disease. Why is that so? And we are vegetarians. So the idea is that most of our South Asians are also dying sooner. 25% of them get heart attacks before the age of 40.
Wow.
And 50% before the age of 55. We are 4% more likely to get heart attacks than other ethnic groups like Chinese or Vietnamese, Japanese. And therefore, the American Heart Association has put as a separate entity, being a South Asian descent becomes a risk factor for heart disease.
Yeah, that seems a little counterintuitive until you get into the details, and then it starts to make more sense. What's the most important reason for you to be vegan now? It might have been different when you first went vegan, right? So now, what's the most important reason for you to be vegan?
I just did a half marathon 2.5 months back. I'm eating well, I'm sleeping well. The 6 pillars of lifestyle medicine now are eating better, and I'm on plant-based diet. Exercising, I'm doing the exercise. 8 hours of sleep, I'm getting 7 to 8 hours, yes. And my stress levels are far low because of meditation and yoga and breathing exercises. Then, social support, yes, it's a little difficult with the COVID situation, but otherwise it is there, good. And if I stopped smoking, I never started smoking. And if I cut down on my drinking, I never drank too much. So in that respect, I am doing everything that I enjoy most at this time. And I want to be a good support, not only to my immediate family, to my friends, to my community, so that I can steer them towards first a flexitarian and then towards a whole food plant-based diet, so that we all can participate in this great God-given gift. It's not plant-based diet. It's just a plant-based way of living. It was never meant to be anything else.
What I'm hearing you say is most important maybe now is to be a positive influence on others.
Absolutely.
Yeah.
Absolutely. Because remember one thing, that fatty streaks start at the age of 8 to 10.
So you want to help people before they start getting too far into the deadly lifestyle. And you're also saying a whole food, plant-based, it's not just a diet, it's a lifestyle, is what you're saying.
Yes,
and
sir.
that reminds me of lifestyle medicine. Is that something you could talk about for a second?
I've just given you the 6 pillars of lifestyle medicine. I'm going to go and give a talk in San Antonio to the American Association of Physicians of Indian origin on lifestyle medicine. Lifestyle medicine, the 6 pillars that I talked about are the fundamentals of lifestyle medicine. If you can do this properly, there are very little chances that you could get a heart disease. Remember one thing, heart disease is the leading cause of death in the US, India, and worldwide. It kills more people than COVID and more people than all the cancers combined.
When we talk about this stuff, it's not like we're trying to become invincible. It's inevitable we're all going to die of something. And it could very well be that a vegan dies of heart disease and does everything by the book, right? But I like what Furman says. He says we're designed to live long and die fast. That's a good way of looking at it because it's inevitable we're going to get something. But what we're talking about here is trying to prevent chronic disease that leads to premature death and increasing our health span.
Another cardiologist, he said that, we are all eventually going to die, but I don't want it to be my fault.
I don't want to be the reason why.
Why? I don't want it to be my fault. I don't want it to be the reason why.
Was it Kim Williams that said that? Maybe?
Kim Williams.
Okay.
He wrote a testimonial in my book too.
Oh, nice.
After reading that. When we say the relationship between nutrition and longevity, it's important. People must understand that each cell of our body has 46 strands of DNA, which are coiled into chromosomes. Now, all these chromosomes have a cap. It's like a cap on your laces so that your laces don't frail off. But what happens is that once, as you grow older, these cells divide. And these caps are called telomeres. So these telomeres get shortened and shortened, and once they are no more, you die. Now, good food will increase the length of the telomere, and bad food that we have talked about so much will decrease the length of the telomere. This is based on telomerase. Telomerase is an enzyme that either works on the telomeres. So Dr. Elizabeth Blackburn, she was the one who discovered telomerase, which was, she got a Nobel Prize for this. And so with the help of the Defense Department, what they did a study. And what they found was that if those people who were given a 3 months diet of a whole food plant-based diet immediately got their telomeres to lengthen. So, and at the same time, diet which is full of soda, processed food, refined, a lot of oil and sugar, these telomeres started shortening faster. So they did a study, and what they found was that even if you do strenuous exercises and a very restrictive calorie diet, you will lose weight and you will look better, but your telomeres are not affected. The telomeres don't lengthen. Except when you have a whole food plant-based diet, they have to shorten, but it doesn't be so quick. It takes time for them to shorten. So that means you are living long and you are living healthier. Because lifespan and health span are two different things. We are, because of how we treated the consequence of the disease, we are all living longer. Heart transplants, liver transplants, kidney transplants and all that. But health span, terrible. It is a saying that we all want to grow old, but then we fear old age.
Didn't Dean Ornish also demonstrate that eating whole plant foods and lifestyle behaviors in general could lengthen telomeres?
He did that too, but the telomerase enzyme was found by Dr. Blackburn.
Cool.
Dean Ornish is the ultimate guru. And somebody had given me a book a long time back, his first book, which I had not even, I just took it home and put it away. I wish I had paid more attention. I don't know, I was in a state of, well, bygones be bygones. I'm now started living at the age of 61, so you can just think about that this is a 13-year-old who's sitting in front of you.
So now you're 74, right?
Yes. I'm going to be 74 next month.
Oh, cool. Essentially, your life started over 13 years ago.
That's it.
Yeah. You know, some people talk about moderation. You having gone from whatever you can eat, standard American diet, to a flexitarian, healthier diet, and then just eliminating animal products altogether. Why wasn't moderation an option for you? Like moderately eating animals?
I did the flexitarian was cutting back on meat, eggs, and dairy, and I tried that, but it wasn't helping me. It was better overall. My health was better overall than what it was. But I did not completely get rid of the problems that I had of my stomach problems and constipation. I did not completely get rid of. So to me, I just felt that there is something more to it than just partly giving up something. But a lot of people turn around and say, go cold turkey when you want advice. I don't. I said, go cold turkey if you have got a great willpower. But otherwise, take small steps. Confucius The Chinese philosopher said to build a huge mountain, you have to carry small stones first. So wait a minute. Let us take short steps. Let us give up one thing. But I believe one thing very strongly, that in my personal life, what I did was, if I gave up something, I used to love burgers. So I gave up burger and then I introduced something which was earthy, which tasted like meat, like a mushroom. So I took a mushroom and put it on the spinach and had that, which gave me the earthy this thing. If I wanted a steak or something, I would look at jackfruit, which is very earthy and that taste comes in. 4 years back, on New Year's Eve in the same house, I had 3 other couples who were here spending the New Year's Eve with us. And so the next morning I told them that, look, I'm going to prepare you scrambled eggs which you have never tasted in your life. And they are all non-veg except my wife. Next morning I made them this, I took some hard tofu, put all the ingredients, all the spices and flavorful things, and I presented it to my guest. Trust me, this is the honest truth. They said, wow, we have never had scrambled eggs better than what you have prepared. And then when I told them that it was tofu and not eggs, they were shocked. And one of them, just to prove a point, just because he wanted to be hard head, he said, oh, now I realize why it did not taste that good. But they were all fooled. So you can do it by others, but all you have to do is think about a thing which is very similar and use that. And you know, Dr. Khan, he mentioned that have a few things to choose from. It is easier. Then when you have your think about wines. Somebody tells you, okay, choose from these 5 or 6 wines, it's easy. If somebody gives you 200 wines, you're lost. So the whole idea is make it simple. I don't believe in processed plant foods, but then it is better than eating meat.
Now you've went into how to get started kind of question. These are great tips for getting started. Is there anything else you want to share on how to get started?
Anybody who wants to do anything, whether to write a book or make a new adjustment, they first have to ask a question, why? Why am I doing it? In this case, I think it is slightly different. But I'm talking about people who have turned around and told me, I am 25 years old. I have no problems. I have no blood pressure, no diabetes. I do exercise. I'm feeling great. Why should I change? And I tell them, look, I said, I'm giving you prospective studies on my patients who were 25. They felt great. And when they turned 35 to 40, they got type 2 diabetes and got a heart disease. Now, if you want to take the risk and play Russian roulette and wait till you're 40, that's your choice. Yes, medicine will advance to keep you longer, so you will live long, but you will not live healthier. So my point, first of all, with my patients is also, I keep telling them, I'm not worried about you living longer or you're not going to get disease, how good you're going to feel. You have certain things, then you want to change. So, do you want to get a heart disease like I've had? Yes, I can turn around and say, that made me change. Now, are you going to learn from these mistakes and make a change right now so that you don't have to be where I was? That gets into my patients sometimes, because here is a patient talking. Use your own imagination. The other day we made garbanzo beans, chickpeas yogurt. Amazing, amazing. All you have got to keep it in water for overnight and then put that starter. Next day, squeeze it in from a cheesecloth, put it in the oven, not on, but just in the oven for overnight. Beautiful yogurt. There are so many things. Few sites that I found very helpful are We Did It Health. And number 2 is Desi Whole Food Plant-Based No Oil Diet. They love to have you in their groups, and they have 5 to 6 recipes every single day.
As far as how to get started, it sounds like one of your chief recommendations is to know the why.
Know the why.
Yeah. And then also baby steps.
Baby steps.
Yeah. Unless you're somebody who can, for lack of better words, cold turkey.
That's what I said.
Yeah, exactly.
You can do that if you are strong-willed, but other than that, no, you cannot.
Mm-hmm. And some people, Dr. Clapper says, there's about maybe just a rough estimate, 20% of people who have legitimate issues trying to go because they've acclimated to eating animals so long that their body's metabolism takes time to adjust to everything from their microbiome to how they synthesize certain proteins and everything. So there could be some legitimate issues that make it hard. So baby steps would be very helpful for that. Just incrementally adding more and more of these whole plant foods. Sounds like
you may not initially. Some people give it up because of the transient distension and bloating, but that is because the body is getting used to it. Just give 3 weeks or a month. That is going to disappear.
Yeah, so this goes into another question of why do some people fail at being vegan? Why do they fail? And so we just hit on that. So let's talk about that for a second. What I'm hearing you say is there's some bloating maybe going on and they just need to give it a few months. But some people, they'll switch up and they never really give their body time to adjust. Can you talk about that for a minute?
Addiction. It's like a moth to a flame. That is the high that they need every day. That is the high that I needed every single day to survive. Now, when I would give that up, what does addiction do when you give it up? Withdrawal symptoms. So you have to, just like in anything, drugs or alcohol, you may, not all the people, it's not like drugs and alcohol, but some people may have a time period when they're getting used to it and may get some kind of mild withdrawal symptoms of distension and bloating. But that addiction is there for food. You have a food addiction too. When you are addicted in that manner, then you have to give it time. You may fail. You see, my roadmap is not for everybody else to follow. Each person has their own way of doing things. But the ultimate goal is the same. How we take the path is different. Some people may do it overnight, some people may take 2 months, some people may take 6 months. That is okay. As long as your goal is still there, you may fail. Like an addiction, you may fail with this food. And you may go back to your old habits. But sooner or later, I believe very strongly, the moment you feel better, then you don't want to go back. That happened to me.
The moment you feel better
with the whole food plant-based diet, you don't want to go back. Mm-hmm. When you're in a transient period, you don't know really what is happening, And that is a time when people fail. But once they're completely 100%, when you're 100% now feeling good about this diet, you don't want to go back.
Some studies, they put X amount of people on a plant food diet just to see how it would go and the other people on a different diet. After the study was over, they just stay on the plant-based diet. Have you heard of that?
Yes.
Yeah, I think that's kind of cool. But it's getting people to that point. Some people have a hard time getting to that point. That's why I kind of give Meatless Monday a hard time. I don't feel like it's enough time. What does it take, a month for them to get to the point of feeling good about it? How long does it take? And consistently eating the right foods, right?
Yeah, but let me be what Dean Ornish said, mm-hmm. that even if you cannot completely become a whole food plant-based diet, it is better. Of course, all doctors want everybody, the research and physicians, we are research and physicians, we treat the cause. So we all want them to be whole food. But what Dean Ornish said was very true. Even if you cannot completely, and you are at least giving up meat for a certain period of time or giving up dairy and doing it for a certain period of time, it is better than not doing anything. Only thing, I come back to the same point. If I am going to take most of the people that I've noticed, patients and friends and family, They cheat. And then they say that they're not feeling better. When you want to eat packaged food also, remember, whatever you cannot pronounce, don't eat it. Including myself, I as a physician cannot pronounce. So why should I eat something which I cannot pronounce? So that is my number one. For a heart patient like me, that look, you do only a little bit. If I do only a little bit, I will get a little bit of a heart attack. But I will get. So for people who have got heart disease, people who have got high blood pressure, people who have got type 2 diabetes, people who have got obesity, high cholesterol, then it is a must.
Then they have to be absolute. You say if people have heart disease or hypertension, whatever, but don't most people have heart disease? By the time they're 8 years old, I've heard 10 years old, Gregor says if you're over the age of 10 and you're on the standard American diet, it's not how to prevent heart disease, it's how to reverse the heart disease you already have.
Absolutely true. Atherosclerosis or plaque buildup starts at that age. Now, if you are going to be reasonable about it and say take very little meat or very little dairy and you try and you may have problems, but later on, not at 50 or 40, at 70. But you are going to get those problems. We are trying to help people around here. We have to be activists. Being a vegan is helping me. I want this message to go out to people that helps them so that we all can live. I want a legacy of people living a healthy life. And I don't want them to make the same mistakes. Also, I want them to understand old age is not a criteria for changing your lifestyle. I did it at age of 61. People can do it at any age. Even if they are 75 and they feel that now they are having a life of blood pressure, diabetes, all that, change. It'll still be beneficial. But I'm worried also about the younger group. Just about 2 months back, I had 2 calls from one 48-year-old, one 41-year-old, both having massive heart attacks, and their wives were crying over on the phone when they were talking to me. So it is very difficult to turn around, but the why is very important. Do you want to do it? Somebody sees the father dying at 40 years, they want to change. Somebody who sees the brother dying, you ask any South Asian. Go ahead, tomorrow you go and ask any South Asian that you see in America and ask them, do you know anybody who has died of a heart attack or had a heart disease in your family? 90% will tell you yes. It's true in Americans too.
I think the biggest way to fix all of this is to help people realize how important it is to raise our children right. And when we start raising our children right, it's just going to progressively change the world. Now, you studied pediatrics.
I do pediatrics too, yeah.
Okay. How practical is it for people to raise their children vegan?
Very, very, very difficult. Unless they change hospital food, school food, you're not going to change them. So if you come home and you are eating a proper plant-based diet, but next day in the school you are getting French fries and a burger, it makes no sense. Better still that you're eating at home, but makes no sense. You cannot completely change them. So the change has to be in government institutions, hospitals, prisons, everywhere. So that kind of a change is a total. Beirut, Lebanon, the hospital over there is the first hospital that has gone completely plant-based.
Parents can raise their children vegan, correct?
Of course.
A proper variety of whole plant foods. Is that a healthy way to raise children?
Absolutely, because see, what I said was difficult because of the school lunches. Mm-hmm. But if I am saying that if you give a packaged lunch to your child to eat at lunchtime, then you're a winner. It's a win-win situation. It is a win-win situation. We have brought this up. Why? Because of our diets are such that either you die at 50 or 60 or you be miserable at 80 and then 85, 90 is the maximum you can live and you die. This is what we have created. There is no reason for people not to be centenarians. You know the blue zone that is in Okinawa, Japan and Italy and California and all that. All these people had one thing common. They all ate a plant-based diet, heavy plant-based diet.
Predominantly.
Predominantly, and they were moving activity. See, our thing is what? I went to the gym in the morning, they say, and I've done my 30 minutes or 45 minutes or an hour. Now I'm sitting at a desk job and not moving at all. See, the whole idea is to move. It is better to move the whole day than to do 30 minutes exercise.
Yeah.
Exercise is equally important because exercise can increase your good cholesterol. My good cholesterol was 29 when I had the heart problem. Normally it should be about at least 45. It is 59 now because of my exercise and moving.
It's totally appropriate to raise children vegan, whole food, plant-based, correct?
It's a fallacy to think that if we don't give them these burgers or animal proteins or hormones, they're not going to be big and they will not be athletes. No. Everybody I see around which are plant-based and all that, the children growing up, they are sturdy, they're muscular. It's like, of course, one little boy told me this thing that in our India we are called uncle, So he said, Uncle Akil, do you know that elephants don't eat meat and hippopotamus don't eat meat? When you catch them young, then they don't miss the non-veg diet. See, I had 8 to 9 families in Gadsden when I came over to America as doctors' families. And all those doctors' families were vegetarians.
Healthy vegetarians or unhealthy vegetarians?
In between.
Okay, so my question though, very specifically, is it healthy and appropriate to raise your children vegan?
100%.
Okay.
No doubt about it. You will get all the macronutrients and micronutrients that you require. Only 2 things should be done, vitamin D and B12.
Is it healthier? Is it the healthiest way to raise your children?
Yes.
So if this is the healthiest way to raise your children, wouldn't the other ways almost be borderline abuse?
Yes. To be very honest, it is an abusive this thing, but I don't say that parents are doing it knowingly, but they're unknowingly just continuing because what their doctors tell them, what the nutritionist in a hospital tells them, that you have to have this cow's milk, Similac or whatever you have, and if you are not breastfeeding, then give this. The people who are leaders, who are aware of things, and some people are followers. So whatever the doctor or the nutrition says, or whatever the grandmother said or the mother said about that, they're doing the same. I cannot go, or Dr. Khan or Dr. Neil Bernard, we cannot go to billions of people and give our story. I wish we could. I wish people would understand what I have gone through. Because remember, unlike Dr. Neil Bernard and all that, like I said, we all believe that standard American diet, I said, was a bad diet, meat, eggs and dairy. And whole food plant-based no oil diet is the way to go. This is where our similarity is, that we are all resurgent physicians believing in this. Now, they are luckier than I am because I got heart disease. When I got heart disease, I was at the other side of the fence too now. I became a patient. So when I'm talking to a patient, I'm not only talking as a physician, I'm talking a heart disease patient because I have been through what he is going through. And the third thing is that because I felt so good on this diet, that I started increasing my exercise. So I had given up long distance running. The last one I did was 2016 in Mumbai. But when they called me 2.5 months back in San Antonio, I started running again. Why? Because I was feeling that good. So that's my third hat. That of an endurance septuagenarian athlete. So this message that I can give to people who are trying to do athletics or who are athletes, people who are heart patients, because I am a heart patient, and people who want advice as a physician, and people who want to learn from my mistakes, because I had insurmountable health problems that we discussed. Do you want to go through that? Horrendous, no.
You know, diverticulitis is an interesting one. I've heard people say, the doctor doesn't want me to eat the food you're eating because you know, it could aggravate it, right?
There is some truth in that. The reason being that once you are on an standard American diet and you get diverticulitis, that is inflammation or infection of the diverticuli, then at that time, see, now it is inflamed and infected, your diverticuli. So now if you eat a lot of roughage, a lot of fiber, then you are going to upset that inflammatory process. So for that period of time when you are having the diverticulitis, you have to be on a low fiber diet for a few days. But once that bout is over, you are again back to normal. You have to start the whole fiber diet, the whole food plant-based fiber diet, because that is going to protect you from getting further attacks of diverticulitis. See, we already got diverticuli because of the bad diet. I have diverticuli in my colon. But now if I start eating a low fiber diet, then I strain because I get constipated. If I strain, I get more diverticuli. And then I get the inflammation and infection. Generally speaking, you should be taking immense amount of fiber. But during the attack, you're supposed to take less fiber till it heals. Again, if it is not a severe diverticulitis that does not put you in the hospital, I don't believe that people should take antibiotics. It will resolve on its own. But if you're very severe, like my perforated, 103 temperature, I had to be taken to the hospital. And I don't care if the surgeon who was there who told me this, but I'm going to be open about it. The second diverticulitis attack with perforation, my GI and we were talking about it, and suddenly I see a surgeon in the corridor. So I just told the nurse that, why don't you just ask him, I need to talk to him. So he came in and he looked at my CT scan and he looked at my reports and he said, look, I distinctly remember that day, it was Friday. And he looked at me sitting over there across my bed, and my wife was sitting on the bed with me, and he said, if I don't take you down and remove a part of your colon, you may be in danger of having a severe infection and dying. And my wife was in tears. Imagine, I am a physician and you're telling me this. I called up my GI that I know and we discussed. And he says, don't let him do it. This is your second perforation. It's a very minute perf. What is your temperature? What is your white blood count? Everything was normal. He says, don't let him touch you. And you know what? I met him in a party, the same surgeon, a year after. I don't know how to say this, but it is the truth. He looked at me from far and says, hey, Dr. Taher, so you did have to get that colon off, right? And I said, no, my friend, it's here intact and it's doing beautiful. These are the stories, and these are personal stories. See, these personal stories other physicians may not have, and they're so lucky because they did not go through what I went.
What are your thoughts on fasting and maybe intermittent fasting? Do you have anything you want to share on that? Could that be a way of maybe approaching some of these ailments and then transitioning into a plant-based diet?
I believe very strongly in intermittent fasting, but am I a proponent of that to myself? No. But in a way, I'm doing intermittent fasting. They say intermittent fasting is 16 hours. I try to eat my supper before the sun goes down. So I eat that at about, say, 5 or 6, depending on which time of the year it is. And then I have my first meal in the morning, my smoothie of different fruits, is about at 9 o'clock or so. So if you look at it from 5 to 5, 6, 7, 8, 9, about 14 to 15 hours, I'm already fasting. So I'm doing intermittent fasting practically every day. But people who are used to eating at 10 o'clock in the night and getting up in the middle of the night and eating and then having a big, huge breakfast, these are the people that would be helped with intermittent fasting to get on the right track. And even if otherwise, even if you're a whole food plant-based diet, and if you can go through the intermittent fasting knowing that I am now doing, I think to me it is even more psychological. If I can stay away for food for 15 hours, why can't I knowingly stay away from food? But somehow my mind is not set up that you have to fast. That's my weakness.
What are the kind of foods you like to eat? You mentioned smoothies in the morning. Let's go through a day eating with you. Breakfast, lunch, and dinner.
I get up in the morning. The first thing that I do after brushing my teeth is to take a huge glass of lukewarm water with apple cider vinegar, a teaspoonful of that in it. This is to cause the alkaline in your body. So I do that and it has helped me tremendously. It is a natural laxative. Once I finish that, I will take every fruit that is there in the refrigerator or otherwise and make a smoothie for me and my wife. But I will not have it. I will then go and do my coffee. That 1 cup of coffee I take with pea milk, PEA. It gives me the protein too. And with that, I watch the morning news on the TV. After that, I come and take my smoothie, the fruit thing, and then either go out if the weather is good for my 5-kilometer or 3-mile run, or I may do at home my treadmill or elliptical. Once I finish that, then I will start a little bit on my yoga, my meditation, and my breathing. Meditation, I don't do it every morning, but at least yoga and breathing, I do that. So once I finish that, I come down now to have my breakfast. And the breakfast is always, like I said before, the scrambled eggs with tofu or a cereal, oats with a lot of fruits on it. I don't do so much of nuts because of the fats in it. And for some reason, it does not agree with me when I do too many nuts. By this time, it is time for me to do my telemedicine for 2-3 hours. Then I go back to the lunchtime. I'm moving around. I'm lunchtime. And then this is the time when I will have a probably cucumber, a tomato, a sweet potato, and avocado sandwich, which I make on Ezekiel bread, the whole grain bread. And then I will probably have a soup, bean soup or something of last night. And then in the evening, my wife will take any vegetable, whatever it is, bok choy. And you know, I love to play this game with my patients. We always say, okay, from A to Z, how many vegetables can you name? And surprisingly, we have named every damn alphabet, I tell you. So there is so much of vegetables that she will make a vegetable or an 8-bean soup and simple things. Simple. I have a lot of baby zucchini, baby corn, broccolini, steamed with different flavors when I'm having my glass of wine. This is a time now to meditate. So my wife and I meditate. I'm not very good at it, so I take my wife's cue on that. She will say, now you have to do this, you have to do that. So I do that and I go to sleep at 9 p.m.
To kind of organize these types of foods, you're eating things like beans and greens and Can you go over these categories? Beans, greens, grains. I say 10 things: beans, greens, grains, fruits, veggies, mushrooms, nuts, seeds, herbs, and spices.
That is pretty much, because there are only 4 or 5 groups. The first group is legumes. Your lentils, your peas, your beans, and all that is in the first group. Your second group is your grains, your quinoa, your brown rice, your amaranth. These are all comes into the couscous, all comes into this grain. But remember that it should be not just the endosperm. You see, there is sperm, endosperm, and the husk. So that is why you do not take any polished or refined grains. That is the reason why, because we need more fiber. Then comes the fruits. Now, some people tell me, they read about it and say, you're talking about fruits, but that is fructose. So if that is sugar, so why can't I take sugar which is also fructose? There's an explanation to that. You see, when you take a mango which is sweet or a banana which is sweet, you are still taking fructose like you're taking in the sugar fructose, but you are taking it with a lot of fiber and phytonutrients and the other nutrients. So when you are taking your fiber will not let your sugar spike as you do with processed sugar. It will go slow like the body was meant to, the sugar was meant to go in your body. So that is why we resurgent physicians and nutritionists say that you can have fruits as much as you want, whether it is sweet or not. Because initially I was told that somebody who is diabetic should not be eating sweets, even fruits. But it is okay to have because of that intense fiber content in it. And then you have the vegetables. Now you are talking about the cruciferous vegetables, the kale, the bok choy, collard greens, and what have you, asparagus. So all these vegetables, and then finally comes the question of nuts. And if you can stand nuts and you don't have a heart problem too much of it, you can have almonds, cashew nuts, Brazilian nut, and these are fantastic in the natural fats. So to me, I don't believe that oil should be used if you can help it.
Some argue that nuts are heart healthy, but maybe after having heart disease and having a surgery and all, maybe it takes time before you can reintroduce those?
I did take nuts for a while, but it would sort of upset my stomach. And my cholesterol levels would go up.
Were you eating more than a serving of nuts?
I used to eat a lot of nuts.
Would you have problems if you just eat a serving?
No. If I eat a small thing, but if I do it on a daily basis, it becomes a problem.
A serving?
A serving every day, it becomes a problem.
Ah. But you eat flax every day.
Flaxseed, yes. Seeds are different. Not only that, I can do pumpkin seeds, sunflower seeds, and sesame seeds. For nuts, I've tried to take just the cashew nuts and see if that is, stay away from that, or just the almond nuts, almonds I'm trying to stay away from. Now, I can take almond milk. It's psychological, I don't know, but it does not agree with me, so I've given up and my cholesterol level comes down. So I'm happy with that. But if I were to tell somebody, I would definitely tell them to take nuts.
And only a serving. Yeah.
Be
careful, because some people...
I used to do that, but that is one thing in the whole food that you should be careful about. Otherwise, you can eat anything you want. And the best part of it is you don't have to worry about how much of whole food you're eating. You can eat as much as you want and you will never put on weight, as far as I know.
But the thing about that is it's important to get a variety, right?
When we say variety, we talk about these 4 or 5 groups that we have talked about. If you get your 4 or 5 groups in a day, then your variety is done. Now, I may not be very distinct about looking for cruciferous vegetables of exotic kind, and I may just stick to, say, kale or spinach or bok choy or something that I am familiar with. That is okay. For me, if you've done this 5 or 4 or 5 groups that we talked about, you made it. Your macronutrients and your micronutrients are all with this food. You don't have to take your magnesium and your zinc, which people do. Not with whole food. except vitamin B12. And again, you know about the B12 story. The B12 is because of the soil. It was the bacteria in the soil made B12. Of course, it's because we're using insecticide and pesticide, we are also better off not getting diarrhea and dysentery. But overall, you need to take a B12. Because remember, B12 deficiency I've seen in India. And there the question was, trust me, I'm not kidding, you can get that nervous system disability, the subacute combined degeneration of the cord.
Do you supplement anything?
Vitamin D, vitamin B12.
And you mentioned the nervous system because of B12. But what about fatty acids? That brings us back to food again. How do you ensure you're getting enough fatty acid intake?
The groups of vegetables and all that, they have certain fats. So you are getting your fatty acids. The fatty acids which are cumbersome and which are problematic are the fatty acids like your triglycerides, which goes up. I would love to show you some pictures that I have of my own patients. Your triglycerides are supposed to be about 150. I've seen people with 1,000, 5,000, and I've seen some of my patients, 2 of my patients, 10,000. The naked blood in a tube is like a cheesy sauce.
Wow. But I mean, when I'm talking about fatty acids...
You're talking about fatty acids, about good fatty acids that you require.
Yeah, like alpha-linoleic acid and stuff. You know, it's easy to get alpha-linoleic acid from plants, but the DHA is a little trickier, and we may convert enough, right? We don't know, right? So do you compensate for that at all?
No. I'm not found the need. I personally believe that it is in the 5 groups that you will get enough. I believe that. And you're right when you say that if you want to compensate with that supplement, if people want to do it. But in my opinion, a whole food plant-based diet has only 2 supplements, D and one is B12.
Well,
but you are right.
I started eating sea vegetables and algae. Some of those have preformed, fatty acids in them, DHA and stuff.
Sea algae is nutritious, and you get all your fatty acids and so much of nutrients. But with the plastics and all that, you got to really wash and clear up that. Otherwise, it's a mess in the sea, right now. That's another thing I don't want even people. I used to love fish. That's the last. I was a pescatarian for a long period of time, thinking that I was getting my omega-3 from fish. I had to have it. I was rationalizing, I was intellectualizing myself that no, I need that because of omega-3. Flaxseed can get you, but you are right. These algae and seaweeds and all that you have, even if you go to a sushi place and if you have the seaweed salad, great.
Spirulina's got some neurotoxins, hepatotoxins. You got to do what you do. Got to watch which ones you get. Kelp has maybe too much iodine. It seems like it would be more sustainable. Like maybe we could have our own little farms that would be cleaner, and those environmental toxins bioaccumulate in the fish. They might not really in the sea vegetables, right? So of course fish are going to be worse.
Correct, absolutely. And you brought out a very important thing. I've traveled a lot around the world, and I find that no country has our structure of our houses are. We all, no matter how small a house, we always have a backyard. Grow your own food. Live outside your comfort zone. Adventure may hurt you, but monotony will kill you. So when I say adventure, it does not mean climbing mountains or anything, just climbing mountains or running a race. It means doing something which is different. Say you play chess, or you want to learn mahjong, or you want to do cooking, or you want to do gardening, but you are scared. Do the thing that you fear most, and death of fear will be certain. So to give you the example, when I did my first jump out of a plane, I wore a dark pant so that if I pooped or something, it would not show. But when I did my bungee jumping in New Zealand, so that first one was frightening. But when I did my bungee jumping, I felt like I was a bird because there was no fear. So that's what I'm saying, This is so important. So if you've got a garden, and I tried it out, for some reason last year I got very little, but the year before, I gave my whole neighborhood, I gave them cucumbers that were coming out of my ears. I had tomatoes, I had zucchini, eggplants, I had bell peppers, I had purple bell peppers, immense amount. Why can't we grow our own food? Look at the houses in the third world countries. There are no houses, there are apartments. Look at even in London, if you go there, the houses are small, they don't have a backyard. We do have a backyard, why are we not using it? Because we are lazy.
What is the most important meal of the day? Some people say a salad is.
I don't know, at one time somebody said that you should have a breakfast like a king, you should have a lunch like a prince, and you should have supper like a pauper. So when your organs are active, and your bacteria is active, and your microbiomes and all that, then it makes sense to have a good breakfast and a little less in the lunchtime. It is no harm in starting with a salad.
Yeah.
As long as you're covering the 5 groups during the day, it is no harm in starting with a salad. What am I doing? I'm putting all the phytonutrients and macronutrients and all that in my fruits that I put. But then I'm putting celery, then I'm putting spinach, then I'm putting arugula. So I am putting a lot of veggies too in that. And if I'm putting so many veggies, that is my salad.
Yeah, that's a great way to start the day, I think. In theory, it seems perfect,
I am doing it so religiously, this thing in the morning. Now, for some reason, my wife will not like too much of veggies, so I will do fruits, and she likes a little bit of celery and spinach, that's all. So I will do that and make it separately for her. Then I will put my other veggies that I think are important to be put in. And I do it.
And I think it's also maybe important to emphasize variety, right? Because I know we've already mentioned variety, but there's certain things that you can get too much of, like goitrogenic compounds or...
If you are balancing yourself out and eating enough amount from each group, I don't think we have to really calculate or do things. Your body will tell you. You see, the day you get up and you feel rejuvenated and you feel I want to do things, then whatever you did the past day was perfect. The moment you feel that something, oh yeah, I had the 2 glasses of wine last.
Okay, but as far as like these things can creep up on you though, you don't want to eat just spinach. You want to really get like some romaine and other things in there. Give me your favorite quote or any kind of quote. What's a quote that you like to share with others?
Adventure may hurt you, but monotony will kill you.
Why is it important for other people to be vegan?
It's to save Mother Earth. Whether we do it for health reasons, whether we do it for cruelty to animals, or we do it for climatic reasons, eventually we want to make this earth a better place for our children and our grandchildren.
Do you think we'll ever see a vegan world?
Not in the near future, but we will see a vegan world.
What would that look like?
Oh, you won't require heaven after that.
Nice, I like that. Any regrets? Do you have any regrets?
My only regret is that I wish I had started earlier in life. I'm not dwelling on it because of the immense pleasure that I have now. My other regret is that sometimes even my close friends and family, it is taking time for them and every minute lost on this. And I wish they could understand this much more and help me to spread this heart-healthy message.
Why didn't you go vegan sooner?
Because I was a glutton for bad food. I never knew. I was literally addicted to that, So to me, it was always a problem. It came late in life, but it is no doubt it is better later than never happening. So I'm happy when the changes took place. Pythagoras, he said that if you sow the seed of pain and murder, you will never reap joy and love. I love the saying, you know. On his table, he never had any meat. And he said that as long as people kill animals, they will always be at war with each other.
Was there ever a time before you went vegan where you thought there's no way I could go vegan?
Yes, initially I was wondering, you know, because I loved my fish and my chicken and my sushis. There was a young doctor that I listened to lately, and she said that when I wanted to really reduce my weight, I did a restricted calorie diet and exercise. I felt I looked great, but my insides were not great. So what whole food does is it makes you beautiful inside and out. It makes you healthier inside and out. I had difficulty initially for being a vegan because of peer pressure. I was not being invited to many places. But some of these places that did not invite me, anyway, I didn't want to go to their house. So, so that was different. But other than that, I tried to talk to restaurants in my time, before that do you have any vegan? Then like the Hollywood artists, actors and actresses do, is they eat half their meals at home so that they can nibble at somebody's house. I threw all the garbage, bad foods out of the house so that I would not be tempted. Because that's one thing that I do, have done before, is all or none. If I cannot have a scoop of ice cream when I was before, I had to have the whole bowl of ice cream. When I was sitting with my vegetarian friends, and again I'm being open, and the pharmaceutical companies used to take us for dinners, and they would order their lobsters and steaks just for me. And I would not only eat mine, but I would eat theirs too. I'm so happy I'm in a place where I am that I would not want to exchange this with anybody. Now, does it really give me the longevity after the damage that has been done, and bypasses and all that? I don't think so. But that is not the point. It is never the quantity that matters to me. It is my quality of life. If I can turn around and somebody comes to my home and says, hey, let's go for a 3-mile run, and if I can do it, wow. If somebody says, okay, let's go and do Pikes Peak in Colorado, and if I can do it as much as I'm happy. And if I can be supportive with this message to the people around me, even if I can change one person, my work is done. Sometimes I wonder that how people's minds are working, you know. When I used to do my hospital rounds and I used to see patients with heart attacks, you know what was the main question to me when I entered the room? Doc, I'm constipated. That is an issue that they have in their minds. They're not asking me whether I'm going to die of a heart attack. I'm constipated. See, this is because older people, you may say whatever you want. Older people, their bowel movements are a big problem for them. And that has all started with a low fiber diet when they were young. And when I talk to my younger patients and try to say 30, 40-year-old that look, give up all this and that, otherwise you'll get a heart attack, they're not listening to me. But if I tell them the endothelium is the same in the artery in your heart and the artery in your penis, and you will get erectile dysfunction if you don't stop smoking and if you don't stop this meat, boom, they will listen to that. But they won't listen if you tell them you're going to get a heart attack.
So are you saying some of the challenges you've had is dealing with patients?
Oh, yes. Yes.
What are some of the challenges you've had with being vegan? Like,
There were not enough vegan restaurants. There were not enough vegan groups. At one time, I got tired of just steaming my food because you need taste. So, and not being, and another thing I want to put a disclaimer over here, that the food that I eat is cooked by mostly by my wife, because if I try to cook, I'm not a good cook, so I may mess it up, But I follow. These are the only things that hampered me. The biggest one was peer pressure.
peer pressure among your colleagues?
Among my colleagues, among my friends, among my family.
How do you deal with that?
I would sort of make it a point, say if I've been to Thanksgiving at my cousin's place or my brother's place, then the next Thanksgiving, in that Thanksgiving, I would say, why don't you all come to my house? And then surprise them and take extra care to make it really, really appetizing. And when they had this, then they say, we can do this for Akil next time he comes to our house. And then they say, okay, the next one, we'll totally do this and see how it goes. So you have to steer them. But now they're all changing. It's 2 days back when I gave the talk in the library. Oh, the response was amazing. They all wrote me emails and text and phone calls that we want to buy your book, we want to hear you more, because you've been through it.
This leads me to the next thing. How do you encourage others, and what have you found to be most effective?
For the younger people, they should have choices or options that are equally good. And then tell them to try it out. I tell people, if you're giving up dairy, give it up for a month. If you don't feel good about it, go back on it. 90% will say, wow, and they'll give it up. The 10% who say no have not really followed the whole thing. They've either had some cheese or something, not thinking it is dairy. You can bring a horse to the water, but you cannot force the horse to drink. You cannot force them. But if your examples, or you turn around and say, we have got now 600% increase in veganism. So we are going to the right. And which are the countries which are really vegan conscious? US, United Kingdom, New Zealand, Australia. These are the leading countries. So I am very happy that we are going on the right track. And it can solve a lot of problems.
So encouraging others through example sounds like giving them the suggestion to try it for a month. If that doesn't work, you said, if it doesn't work, go back. But shouldn't they try again? A lot of times I feel like when people fail, they don't try to go see a plant-based doctor to get suggestions on maybe how to introduce these new foods, or see if there's some maybe food sensitivity or allergy that they now are discovering that they didn't know before, Shouldn't they try again if it didn't work?
Of course they should. But see, what happens is the moment you've got allergies and you can't control with antihistaminics, they go over to the dermatologist or the allergist and then they start getting the test done. Then they're getting the shots. So that's a vicious cycle. So my point is that only by chance people find out, oh, I was suffering so much, but then I saw the China study. Oh my God. Then I wanted to do it. Oh, I read How Not to Die by Michael Greger. Oh, now I'm into it. It's by chance. So we should be telling people more that read these books, see the game changers, fork over knives. We should tell people, even if we have to spend of our own pocket, I don't mind, that, okay, go get Netflix this thing and go and see this. But we have to spread that word. Or for that matter, read this book. I would tell you right in front, right now I'm telling you, if you find this book, that if it does not help you, or it does not save a life, or does not help to increase the quality of one's life, I will repay you back for this book.
How can they find that book?
It's available on Amazon. Go over on my site, akiltaher.com. That's my website.
Can you look at somebody and tell if they're healthy or not just by the way they look? Maybe they look like they're overweight. Maybe they look like they're too thin. Because a lot of times, people say that person doesn't look healthy. And it could be that they're just used to something else. Or maybe they don't understand this person has an endomorph body type and a lifestyle not conducive. Maybe they've been through an accident, whatever. Can you actually look at somebody and tell if they're healthy or not?
You see, sometimes we doctors have this thing. We can have the ashen appearance of a patient and we can say something is wrong. Or a pallor that may be anemic. But sometimes it is very easy to find out that he's a very anxious person, will be always doing something. But you can't really gauge the mental this thing of a person. Because he may be severely depressed, but he may be in a manic phase. So he's okay. And if you are in physical this thing, you see how many times, where's the best place to find out unhealthy and healthy people? At the airport. When I go to the airport and I sit over there and I see people, they're grossly obese, they can't move from here to there without stopping and getting short of breath. While I see a person who has got gray hair, looks in his 60s, and is just not even using the rail thing, but walking. So you do have that. You can see a person who is healthy. And when he opens his mouth, the words that come out, while the person, because we as doctors have known, yesterday I did not sleep well. Something is wrong. And heart disease is not the leading cause. I may have made a mistake. It is the standard American diet that is the leading cause of death in America.
Now, some people look at some vegans and they say that person's overweight looking or they're obese, but they don't know. I mean, they're not factoring all the variables in. And some people just have a broader body type, right? Is that true or not?
Yes. Let me explain.
And one more thing I want to throw in there, and then maybe you can add this to your explanation. Mm-hmm. Isn't there a difference between a vegan with the same BMI as a non-vegan? Isn't there a difference in the type of fat they have? Subcutaneous versus...
In my case, BMI should not be the standard. Because in BMI, you miss out a lot of people. Being a South Asian, I can tell you this, that if you go to India tomorrow, you will not see anybody obese, but they're all carrying fat. They're carrying fat in their bellies. So they have fat around the hearts, in the liver, in the muscles, the unhealthy fat. The healthy fat is the one which is subcutaneous. So I say do the abdominal girth. So you find out your circumference of your abdomen. If it is, they say, should not be more than 32 inches in men and should not be more than 30 inches in women. I say less, maybe 30 inches in men and 28 inches in women. This is what I believe. Because when I was diagnosed, when I had my heart disease, what was my body mass index? 23. So I would have fallen through the cracks. So you go by visceral, but what, did I carry fat? Yes. Like the kangaroo carries the pouch, I had a pouch. That was visceral. And visceral fat, a lot of patients in the crowd when I talk, oh, but I do tummy tucks and crunches and all the abdominal crunches. That's never going to reduce your visceral fat. Your visceral fat will only be reduced by diet. And your visceral fat is directly linked to heart disease.
But some people are broader, genetically speaking, somatotypes, right? Is that a thing?
Of course, but they're carrying subcutaneous fat. Mm-hmm. I've seen a lot of large gentlemen and ladies that come into my clinics, their body mass index are way above. but they are healthy. They're eating right, they're doing everything. It's subcutaneous fat. See, a fat which is not just the belly, but 20% or 30% of the people that I see on the airport or roads or everything have a belly. Your belt is down here in your suprapubic region. So the whole idea is that fat is what you yourself said, a subcutaneous fat, which is a healthy fat.
About Indians and culture, I spoke to somebody Hispanic recently, and they were like, in my culture, we eat a lot of animals, or in your culture's case, a lot of dairy. But can't you still have your cultural traditions and enjoy all of whatever it is that's enjoyable about spending time with family and friends and cultural traditions? Can't you still have that and not eat animals?
You see, cultural traditions as such, it is very hard to break. You see, you can reason with them till the cows come home. But if it is based on their culture, it is very difficult. What I have found is, if you kill an animal for whatever reason, for a sacrifice or whatever it is that is happening in certain cultures, it is shameful. Why would you want to torture an animal for your satisfaction and then say this is a gift to the God, or this is our way of saying thanks for all the blessings we have received from Him? This is absurd.
But we could still have these get-togethers and whatever it is without doing that, correct? I mean,
Of course,
yeah.
of course. I'm trying to move the Muslim community in not killing animals on their Eid days, because I believe that that is not right. And maybe if they hear me on this, maybe somebody will come out to get me. But that is what I strongly believe.
Tell me, do you have any success stories you would like to share where you've helped a patient with this sort of thing?
If you read the reviews on the book of mine, there are a lot of people who have been saved because of the book and what I've told them. One of them was what we call as a healthy person, but eating the oil and vegetarian, but eating oils and sweets and all that. And he was 41-year-old, and he got a massive heart attack. He was taken the Widowmaker, the LAD, and his wife called me with tears. I told them to read my book and then get back to me. They read the book, they got back to me. Oh, he's doing so well. Mm-hmm. I am so proud of him now. And he says, so when I turn around and tell him that, look, I want you to spread this message, sure, you don't have to tell me twice. So he's always there ready for me, because he says, you've given me a new life. I said, I have not given. It's a plant-based. It is you would have done. And the second person that I helped recently, 48-year-old, but in a mess. He was a train wreck. He was a smoker, heavy smoker, non-veg eater. He was doing everything that was wrong. He was drinking too much. It took me a while to get him back on this thing. And his wife was saying that he won't listen. And then she would call me, and then I would go through it. Now he is also on the plant-based, and he is doing fairly well. His results have come down. I've not told him to stop his medications right now. But the other guy is an absolute success story.
What's the most touching success story ever?
It was at my book signing in my small town, Gadsden. A lady came to me and said that, you know what, I came to you, do you remember me? I was embarrassed. I said, I'm sorry, I don't. But then she told me that I had a stroke. The doctors had told me that you will have to live with this. And then I came to you and you told me to go on a whole food plant-based diet. And today The residual effects of the stroke are gone. I'm okay, I'm fine. And then she hugged me. When she hugged me, I don't know, something went through me that this is a life you saved. How many people in other professions get a chance to do this? And she had never written to me or anything except she came for my book signing to get the book, and this is what she told me. That makes you feel good. My son, who has changed now because of my book, is eating more of fruits and vegetables and all that. But he says, that's too difficult. The cafeteria, he works as a hospitalist, means 7 days on, 7 days off. But he's changing.
He did this painting too, right?
He did this painting. He's
Point at it.
This is his painting. Yep.
Yeah. Wow.
This is my son Nick's painting. I'm very, very proud of both my children, daughter too. And my biggest support, my biggest masseuse who can stand up to my shenanigans and bring me down to earth from cloud 9 is my wife. Without her, I would be nothing. Goes my biggest thank you of all the people in the world. She is not an extrovert like I am. She's an introvert. And she takes her things the way she does. But to me, none of this would have been possible. I would possibly be 6 feet under by now.
How long has she been vegan again?
She was a vegetarian for the longest period of time, 30 years, 35 years. But she has become a vegan for the last 20 years or so.
So she was vegetarian for 30 years before that?
No, overall 35 years or something.
So 15 years and then she went vegan.
Yeah. Okay. She just cannot understand the cruelty part of it. Mm-hmm. And she's very compassionate to children, to animals. May I have been subconscious compassionate, but it didn't come across that way. See, I am from the deep south, Alabama. When my staff comes and tells me that my son shot a deer today, and it was such a joy, we had a party for him. I said, how old is your son? He said, 15 years old. So you wonder, do I blame her? No. That's the way it is. It's reckoning. Oh, my son shot a deer at 15. So it is going to take time. But we can do it. We will do it.
I feel like it would be amiss to not share your most recent blood work and angiogram, or have you had your calcium index score since?
My last thing was at my cardiologist. Everything is perfect. My scan was perfect. Stress test was fantastic. He said, I can't believe it. You had a bypass and you had a open heart surgery in 2009.
When was that? Most recent one?
About 2 years back. No, 1 year back.
So in 2021?
Yes, I got it done. I went to my cardiologist. I went to my gastroenterologist. Mm-hmm. And because it was, because I have to go because of the diverticulitis and all that. So he says, I can't believe it. He says, yours is a narrow colon. Now it is looking, what did you do? I'll tell my patients to do that. My cholesterol levels, all down.
Wow.
So my cholesterol levels are down, my blood pressure is down.
Did you have a calcium index score done or an angiogram?
No, he said it is not required because your stress test is 100%. There's nothing, everything is being perfused and you're running like a horse. So I said, okay. What I was surprised at my GI. Mm-hmm. And GI told me that, I've done yours so many times before and there's always...
Polyps?
I had polyps before, cancerous, precancerous. But he says because of your diverticulitis but now it is really opened up.
So do you still have polyps?
No, they've taken it out.
And they didn't come back.
No. One thing I would say though, there are certain things in medicine you got to do. If you don't follow a proper whole food plant-based diet, no oil diet, if you're not strict on it, then you have to get your mammograms and your colonoscopy at the age of 45. You have to get it done. At the age of 50, I had precancerous polyps. So I would not be here to tell you the tale.
I heard a doctor recently say he advises against getting a mammogram because if they find something, what are you going to do? You're going to go through all these procedures and then it's going to stress you out and it's just going to make things worse. It's better to just go on a whole food plant-based diet.
I believe very strongly that when a woman goes to have a shower or when she's in a bathtub or what, you have to examine your breast. 99% of the time, a woman has come and told me that there is something I feel. She has been to 5 doctors before that, none of them have caught that, including myself, because you know your body the best. So if you find something which is abnormal, then by all means get a mammogram. Once you have the diagnosis, then you can think of saying, okay, now I'm trying to do the whole food plant-based and let's see what happens.
Because like I've heard even men who get prostate cancer, for example, usually don't die from prostate cancer. They usually die from something else, but yet they go through all these chemo and all this stuff that it tears them down.
It depends on what stage it is and how much it has advanced, sort of metastasized in your bones and where else. So that depends on that. But the jury is still not out on exactly what to do. So you are right that some people will have a prostate cancer and they will die of something else. But there are also some people who have got very aggressive, a 3rd, 4th stage, and they can die very soon.
Is there any need at all to eat animals?
If you are on an island where you have nothing, there is no vegetation, only sand, and you have fish in the water to survive, I may eat that fish to survive. Or if there are some animals on the island. But otherwise, no.
Not for optimum health or lifespan.
Animal protein is the biggest competitor of our health.
Now share with me some of your major accomplishments after going vegan.
My biggest accomplishment is becoming plant-based. Number 2 is that my clarity of mind, becoming more compassionate, calm. My life is full of purpose, passion and positivity. I'm also intensely driven by doing physical acts which I thought were not possible at the age of 34 or 30 or 35, but I can do those in much better way. So I started off by promising the nurses in the ICU that I would do half a marathon, which I did. But it was there was a dichotomy of fear and excitement at that time because I didn't know if my heart would take me to the finish line. But it did. Still remember, I went to sleep at 9 o'clock, but I couldn't sleep. At 2 a.m., I went to sleep. Then I had a strange dream. I was in the Olympics and they were putting a medal on me. And there were tears of joy. And I was so happy. And they asked me to sing that Star Spangled Banner was going on. And of course, I sang totally out of tune. There I was. Who knows that was the starting of so many things to happen in a way. So after that, in the same year, I went and did a pilgrimage. And again, I was told it was trekking. So I went on to this pilgrimage thinking it is trekking. Now it is in China, in Tibet. So I wanted to get back out of it, but they wouldn't let me. The 2 people that they hate most, the Chinese, is that you have an American passport and you're an Indian. Boom. So when you can't beat them, enjoy them. So I enjoyed the pilgrimage, and that was my next thing. Then when I ran the Boston Marathon, wow, it was Chicago Marathon was the first one that I ran. And it was simply great. I saw a pregnant lady run that, a full term. And she had this thing written on a t-shirt that I've got my OBGYN's permission to run. And it came in the papers that she went and beat her husband by 15 minutes, went to the hotel, and after 7 hours delivered a healthy baby. And so that was my Chicago moment. My Mumbai marathon moment was entirely different, because I saw people run for different reasons. But there was this young guy who was running barefoot. And I asked him, and he says, it was always my desire to run a marathon, but sir, uncle, of course uncle, but I cannot afford shoes. And there he was running in barefoot. There was the camaraderie that was very different from other marathons. The roads were not paved, but that singing of the Bollywood songs and camaraderie was simply amazing. The Boston Marathon, my head story, which was in itself a great thing, you know. Also, I have done a Pikes Peak. I've jumped out of airplanes. I've done the bungee jumping from the first commercial bungee jumping site in the Kawarau Bridge in New Zealand.
You mentioned your accomplishments, so we definitely want to hit that, like your triathlon and your...
I have done the Boston Marathon, in which I see that how helpful Americans are. It's amazing that when I started the marathon, it was extremely cold, and I put a toboggan so that to keep myself warm. But as it got hotter, I discarded the toboggan. And then it got so hot, and I went to a stranger, and I had $20 in my pocket, and I said, hey, I'll give you this $20 if you give me the hat. And he was reluctant at first, but his better half, wife, girlfriend, told him, just take the hat off and give it to him. And she didn't even take my $20. But as I was going back to run, he turned around and said, you know what, that hat has been with me for 10 years. So you please finish the race. And that made me finish the race, even though I had a torn calf muscle. And so there are so many, climbing Mount Kilimanjaro, when you are 66 and you're doing it for the first time, being on anti-malarial drugs, because still a certain height you have mosquitoes in Tanzania. Fact is that in Malaron, the tablet I was taking had one major side effect. It was insomnia. So for the first 2 nights, 3 nights, I couldn't sleep at all, a wink. Now, I am 66. I have an enlarged prostate. They asked me to drink 5 liters every day. So I need to pee. And in the dead of night, when there's a small little tent, which is good enough for one person, then 2 people are sleeping in this, pitch dark, you're trying to find your pee bottle. You can't find your headlamp. When you find your pee bottle, you're turning around to see in a right angle to pee, and still nothing is happening. And then you kneel down on the ground, and then you start doing, and your partner is wondering. He turned around and says, hey, what are you doing? And I said, just praying for a miracle. And then when your pee bottle gets full, then what do? Then you have to go out in the cold, biting cold. But when I reached at the peak, it was a feeling that I cannot express. My grandson was born in that year, 2012, when I climbed Mount Kilimanjaro. And I had a pacifier, and my trainer's a sliver of her wedding dress. And I was supposed to take that out at the peak, and I couldn't find it. It was so cold, my mittens and all that. That last 1 mile is horrific. But when you do that, that makes you want to do some more. But as somebody said, you can climb Mount Kilimanjaro once, that is great, but if you want to do it again, something is wrong with you. See, at the age of 61, I did my first half marathon. Then I did several half marathons, And then this was in 2010. And I also went in 2010 to Mount Kailash, which is also 19,000 plus feet. The thing is that the last 3 days are the toughest because you are circumventing that mountain till you reach 19,300 feet. And that is a Dolma Pass. A lot of people have died at the Dolma Pass. But once you reach there, this was where my moment was. That everybody was high-fiving and hugging. I wanted to be alone. I went around and sat in a place and I said to myself, what would it mean if I didn't have any material things? And I was so happy at that moment, and something must have triggered for me to come down and my wife to notice that I had mellowed down my type A personality. When I ran the marathon, Boston Marathon in 2014, this was after the dastardly bombing in the Boston Marathon in 2013. I raised about single-handedly $4,000 for them. Then in the Chicago Marathon that I did previously, I raised $10,000 plus single-handedly for the American Heart Association. When I ran the Mumbai Marathon, again I raised a lot of money, about $14,000, and I gave it to the PETA in India and the St. Jude's and also to the Heart Association in Mumbai. That is the city that I grew up. So I'm thinking of doing this charity work as much as I can do. Even right now, everything that I am making is going towards a charity. I went to Machu Picchu and did trekking over there. I went to Bhutan, I did trekking there. Triathlons are difficult things to do, especially when you have a zero speed fall is a must for anybody who has done biking with clip-ons. I fell so many times, and this was pretty late. I mean, I was 64, 65 years old. But then I learned how to fall without getting hurt. One thing you must remember, that when I came to this country, and when my brother, his wife, and my wife and me, we all went to the park and they used to run. This is when I was 40 years old. And they used to run or at least jog or at least walk. I couldn't do it. My plaques were there at that time. But I didn't realize. I would always say, maybe I've got too much, I'm too anxious, I'm worried, I'm this, I'm that. But then my wife would notice, but see, we doctors are worst patients, that your face looks ashen. There's not enough blood supply, but all said and done, it all worked out.
You got a book there, right?
Yeah, I got a book which I've written a year back in February. I think it's just about a year now. It is called Open Heart. It is a transformational journey of a doctor who, after bypass surgery at 61, ran marathons and climbed mountains. This book, Open Heart, is extremely dear to my heart. The name I've chosen, Open Heart, is because I was opened up to get an open heart surgery. I want people to understand, let Mother Nature do an open heart surgery on you, to create an open heart so that you don't have to undergo a surgeon's knife. This book will do several things for you. I want you to come on a journey with me on this book, whereby you experience the agony of living in this worn-out, exhausted body with seemingly insurmountable problems, and how I dealt with these with the help of basically a whole food, plant-based diet, as well as exercise, meditation, yoga, and breathing. It will also help people understand and learn from my mistakes so they can take small steps in improving their own lives. If I can be so open in this book with my shortcomings, then people would understand, readers would understand and be open about their shortcomings and how they can conquer these challenges. This whole food plant-based diet, people will understand better if they read the chapter 7 of my book. That is science-backed as well as my personal experience. This book is also a fun book. There are a lot of adventures, having fun, humorous anecdotes, mostly self-deprecating humor, but that is, and if people want to do a marathon or a triathlon or climb a mountain, they can get helpful reading this book and my experiences. And finally, it is a testament that age is not a criteria to hold you down and you can change at any age. And if some of the readers of this book will always find that if they are having a setback in their lives, be it medical or otherwise, and they feel they are at the lowest moment in their life, like in an abyss, this book will bring them not only to ground level, but it will make them rise to heights that they never thought it was possible. So with this, I would end by saying that always remember, diet, a whole food plant-based diet, is more important than exercise. 100% of the proceeds or the royalties of this book are going to charity.
Is there anything that we didn't cover that you would like to say?
There was one race, a 100-mile bike race, that I was going to give up at 90 miles because there was nothing in my body that was not hurting. So what I want to say is, sometimes an unexciting truth can be eclipsed by a brilliant lie. The reason is, my trainer was with me, biking along with me, and we'd reached 90 miles, and I told her, I said, Stacy, I can't do it anymore. I'm giving up. There's nothing that is not hurting. It's cold. And she said, but you read it wrong. Who said it's 10 miles? It's just 3 miles. Oh, really? So I went on then the 3 miles became 6 miles, and 6 miles became, I finished the 100-mile race. That's why I say that an unexciting truth is sometimes eclipsed by a brilliant lie.
That also applies to, it might not appear very sexy or exciting to eat whole plant foods. And then you hear all these exciting lies about meat, eggs, and dairy. McDougall or somebody says, people love to hear good news about their bad habits.
Correct.
It's kind of like what you're saying,
Correct.
Right?
Absolutely. And somebody also said this one other thing, that it is your genes that are loaded in your gun, but it is your lifestyle which pulls the trigger. And these are things will always remain in my mind, So, but very interesting. I mean, today what we covered is going to be extremely helpful to me. आखिर में मेरी यही उम्मीद है कि हर इंसान को प्लांट बेस्ड खाना ज़रूरी है, और जिसका मतलब है कि संयंत्र आधारित होना बहुत ज़रूरी है. धन्यवाद.